to this particular session. It's a session which is going to concentrate on caregivers. We chose this topic because caregivers need to remain mentally and physically healthy to be able to provide the best care to the seniors. I would like this session to be interactive, so please post questions in the chat or raise your hand when the question and answer session begins. I'll guide you when the Q&A begins so that you can use the reaction facility on your gadgets. Yes, this morning we are going to have two speakers, and I'll begin by introducing them, and then I'll ask the first speaker to come on. We'll have a few questions after the first speaker, and then the second speaker will come on, and then we'll have the final questions and answers. Yes, I'd like now to start by introducing the main speaker. I'm honored and very excited to introduce to you a lady of many colors. She's a mixed salad of gifts and opportunities, the type Sir Thomas More would rightly call a woman of all seasons, and that is no other than Dr. Jane Kavuma. She's a senior medical doctor, an accomplished woman health activist, an ardent writer of fiction novels and short stories. Her experience with the health caregivers from Kasangati Health Center makes very interesting reading. When you ask her, she'll say that she has spent half her time trying to make a difference in women's health. Jane has worked in many Ugandan hospitals, including Mulago Hospital. She has worked with NGOs like Family Planning Association, now known as International Planned Parenthood Federation. She has run a private medical clinic in the middle of Kampala. She worked in Botswana for a good 20 years. Jane has represented women in many health fora worldwide. This morning, we are lucky she's going to allow us to peep into her life as a caregiver who has put on shoes of a wife, a mother, a grandmother, a patient, and a lifelong learner, among others. Dr. Jane is open-minded and loves sharing. Dr. Jane is a lady to be emulated by both young and old. Our second presenter this morning will come in after Jane has shared with us, and she's known as Immaculate Nobong. She'll share professional tips to support the caregivers in line with what Dr. Jane's testimony will have shared with us. Immaculate is a Ugandan based in Denmark. She's a professional teacher by training and is now training to become a social and health assistant in Denmark. Her work as a social and health assistant involves interaction and provision of support to caregivers of elderly patients. It also includes rehabilitation of patients, the elderly patients, She works with patients and their caregivers in hospitals and at home. She brings to us today a wealth of experience in the field of rehabilitation and support to the elderly patients to enable them to live a good and enjoyable life. We are now going to dive right into the session, and Dr. Jane Kavma will come on and take us through. Dr. Jane, good morning. Dr. Jane, please unmute. Good morning. Okay, Dr. Jane, you're currently taking care of mom, who is 90 years. And in your own words, you aim at enabling her age with grace and dignity. I have so far about 20 people, including caregivers and seniors, eagerly waiting to hear all about caring for seniors. Allow me to pose a few questions as you share your experience. And I'll start off by asking you to say a few words about your mom. Is mom able to move around? Would you like to just paint us a picture of who the mom of 90 years is at present? Dr. Jane, it's time for you to greet us and start on response to those questions, please. Hello. Dr. Jane.
She's having connection challenges because it shows she's trying to speak, but we can't hear her. She may have to log off and try to log on again to activate her voice. Can someone give her a call?
Okay. Sorry about that, Dr. Jane, but we'll give you a few minutes to sort out that. In the meantime, I just want to remind you that you have questions or comments, please put them in the chat. And this session is usually posted to YouTube after a few days and can be posted to you in case you are unable to finish the round today or you want to share it with other people. Feel comfortable that you are not missing anything. Yes, Dr. Philippa, you might want to fill in with a few comments about oncoming sessions while we wait for Jane to come on.
Thank you. I was actually going to propose that we do that at the end, but in the meantime, I'd probably request Immaculate if she can give us like an overview of the work she does, the kind of people she takes care of, and what challenges she's experienced, and some tips that caregivers could use.
Okay.
A minute, please.
Immaculate.
A minute, please.
The beauty of technology, just to go haywire when you need it.
Sorry. It was my family here. I was trying to ask them to turn off the car. It was loud in the background. Yeah. Thank you all and good morning. I'm called Immaculate Noble. I'm 55 years old and based in Denmark. I recently began this course in social and health, and I work as an assistant. It's a practical education where we are both in school and at work, and we work in patients. At the meantime, I'm placed in a home, and our work varies between homes, hospital, psychiatry, and the like. In this short time I've been in this area, I've got a lot of experience, which I'm proud of, because I've always wanted to work with people. And well, since we are talking about the elderly, yeah, we find a lot of people with the elderly are affected with different types of diseases, but most of them are alongside dementia. And they say that there are over 200 different forms of dementia, of which one of them is Alzheimer. Dr. Jen is going to talk about. When you work with these people, our aim is to give them a good quality of life and help them live as long as possible. And in addition to that, we help them in the areas they cannot support themselves. And we are, as a social and health assistant, I'm a contact between the families, caregivers, so to say, and the medical team, the doctors and nurses. But as a health assistant, we work closely with the nurses. In case, actually, we are the closest people to the patients or people that live in homes or in the hospitals. And it's us that notice the changes. Much as we have the caregivers that do the cleaning and all that, but we are mainly there for their health issues, in case there's a change in their from their habitual situation. Because if we know that someone has a heart problem and lives with it, because we say even if someone is sick, but the person should have good health. So we assume that the heart situation is a habitual condition, but if the heart changes from what it is, that's what we call the actual condition. So we have to keep monitoring what is the patient's condition. And if there is a variation, it's us to ring the doctors up, of course, with all the vitals we have taken and whatever we have done to help them through. So the doctor comes in after we've prepared them. So that's a little bit of what we do.
Thank you so much, Immaculate, for taking us through your work. I just wanted to know, how long have you been in this work? You said a short time.
Yeah, roughly, I should say 1.5 years, because we have the preparation period and then the actual period now when we start full-blown health assistant. We have the other one, which is in Danish, it's called, it will be like a foundation into the health sector. That I think took me almost 1 year. And now as a health assistant, I've been there for close to 8 months. And the whole course is supposed to be 4 years, although I have a shorter period based on because I got a merit based on my previous experience, having worked with an NGO health assistant and also as a teacher. So that's me.
Thank you so much. Do you have any experience of caring given to Ugandan seniors or people outside Denmark?
Actually, before I went to Denmark, I had an organization which was called Sunny Skies Women's Project. And I worked with women based in slums in Acholi quarters. So we had some elderly. I used to take sometimes to Mulago for breast and cancer screening and cervical cancer screening. Of course, we used to diagnose and then refer them to hospitals, do some basic treatment. But right now, I have a mother. They say we are not supposed to diagnose them, but of course, being in the field, based on the symptoms we have, I would typically say that she's on the onset of dementia. I've not classified which kind of dementia she has, but of course, as different dementias progress, of course, they can be examined through blood and MRI scans, CT scans, and they like to establish which kind of dementia someone has. Of course, we may have Parkinson's disease, Alzheimer's, Lewy dementia, and many others. So they're all categorized according to the way they affect the person. But basically, my mother right now my mother has been, I think in 3 or 4 years, she began, first of all, her personality changed. Her personality changed. She began forgetting, asking questions all over. Of course, suspicion, which is some of the symptoms of these diseases. Someone has taken my things, then she's so insecure about people and all that. And in addition to that, of course, she has been suffering from, she has been a heart patient, if I can remember, for over 20 years, but of course, it has been managed. So that's the little part of it I've been doing here with my mother, the times I've been around, although my sister takes the bigger burden of it now. Of course, as caregivers, when she was with my children, they had a lot of conflicts until she had to move in with my sister. But of course, when I came into this field, then I started telling them, I think this is the problem that mommy has now, and please try to understand her, try to handle her with care. Don't push her, because the people suffering from such ailments, especially the elderly, as we said that we should give them the best quality of life, is we should not, much as they may be talking incoherent and all that, we should let them talk and avoid challenging them too much, because when we challenge them too much, we make them more disillusional and they tend to wander, and then they become more confrontational. When you're dealing with such people, give them their time, let them talk. But again, when they're repeating the same things, don't shut them up, because they also have, oh goodness, Danish has really affected my English in a way, sorry. So in a way, they, what should I say? In a way, when you try to confront them, you anger them. And when you anger them, you're actually impacting on their brain, because many of these people, in some extent, they lose speech. They lose speech. Well, we already know that they have memory issues, they have difficulty in language. Of course, they fail to have, time oriented on time and place. For example, yesterday, my mother was around and we were talking about, then she was like, oh, I thought it was Saturday. I said, Mommy, no, today is Friday. Oh, it's because I came here, and I said, yeah. My sister had to go away because she had something to do, but tomorrow is Saturday. And she's, can I stay here? And I was like, Mommy, you would have stayed. I would very much want you to stay around, but the problem is your medication, and your medication is a priority. And she's like, but I have some medication here. And I'm like, Mommy, you have to have time for your medication. Actually, that's another important thing in caregiving. We are not supposed to leave them with medication. Medication is supposed to be given by a caregiver at a particular time, because their tendencies, they could overdose themselves, or they will not take their medicine. And if they don't take their medicines, it might escalate their problem. On the other hand, it's very difficult for them to think abstract. So if they can't think abstract, then what? That means they need support. Their welfare, as we have talked, and moods keep changing. They need all the support. So in supporting them, we give them guidance. Actually, this brings me to how we deal with people in these situations, especially those who have dementia at a higher grade. I had written something here. Let me see if I can find it. People in such situations should eat healthy. They should eat healthy, and what they should eat should be based on what is the best nutrition for them. As people grow older, they have specific diets they have to be on, and exercises. For a person 60 years plus, especially in these critical ages, need exercises of about 30 to 40 minutes. But then they should be done in, what should I call them? In phases, maybe 10 minutes, 10 minutes in the first phase, then the next 10. So we can say maybe early in the morning, walk maybe from here to there, or maybe, you know, as they keep walking around. And another thing is engage them in activities, because these activities we engage them in are also part of the exercises, because as they keep walking around the rooms, it helps them also find their bearing. Another thing is, if any of them is smoking, we should try to stop them or avoid smoking. And so is alcohol. And then we should engage them in a lot of social activities that they can participate in to stimulate their activity levels. And you know, the more they are engaged, the more they feel inclusive. Actually, inclusiveness is part and parcel of caring for people in these kind of situations. I can see Dr. Jen has come in, is it?
Yes, she has. I just like wanted you to, you are touching the very things we want. And I thought maybe you could just finish up that on drugs, and then we can call Dr. Jane in.
Okay. Now, when it comes to drugs, okay, we've talked about drugs, but I don't want really to come into the specific drugs that they take. But quite often when these people are on this kind of medication, it affects them. Some get diarrhea, others vomit, others lose appetite, and others will lose weight. They get running noses.
Sorry about that.
No, it's okay. They get running noses, cramps, headache. Others get confused and have a lot of hallucinations. Some get pain. Others tend to lose their muscular function. And of course, to some extent, some of these people who have dementia feed through tubes, because at some stages of dementia, some people tend to lose, what do they call it? The peristaltic, whatever, in their stomachs, because they aren't active and their muscles have now crumpled up, that they are not active. That's why we emphasize a lot of activities. So if they reach that level where they cannot, their bowel movements are not so good and their stomachs cannot help in transporting the food, then they have to be fed through the tubes. Actually, that's another level which very many people end up with when they have maybe Alzheimer's and the like. So we feed them, and when we feed them through the tubes, of course, they can't do it themselves. It's the caregiver that gives aid, and the caregiver that gives. But where I am in Denmark, the caregivers remain at the level of just cleaning and the like, supporting them. But when it comes to rehabilitation, medication, feeding them, it's the work of the health assistants. And that's basically some of the duties we do. So when we feed them through the tube, it's of course prepared food. It comes already prepared for them. Of course, the nutritionalists plus the doctor and the neurologist have worked together to design which food is best for this particular patient. So it depends on what kind of food the person will feed on. And then again, talking about these feedings, this is again new, that quite often, most of these people on this feeding through the tubes end up with some kind of infection. I wouldn't want to go into the depth of it, but when they get these kind of infections, we've had at least 4 patients lately fed,
Immaculate, just
yes.
Let me just do a bit of guidance here. This session is particularly with caregivers, and
okay.
It just touch on the issue of refusal of like taking drugs, taking the medication, and the feeds. We will do the details later.
Okay.
And
okay. Thank you.
Also the fact that Dr. Jenny is now on. Let's do that wrap up in like a minute or two. Then we go to the main session. Okay,
thank you. Now, when it comes to medication, we say that quite often when it comes to medication, we are not, it's not advisable to let the patients give themselves, medicate themselves. Once medicines are prescribed for the patient, the caregiver should be the person to give the medication, and the medication should be given on time. And once the medication is given on time, we should have what they call the daily rhythm. That is the 24-hour span. So these people have what we call, in Danish, we call it a døgn rhythm. It means the 24-hour rhythm, what the person does from the time he wakes up to the time he goes to sleep. So in this time, if someone receives his medication at 8 o'clock, we should keep it at 8 o'clock, so that the person's mentality is set that at 8 o'clock, I must have my medication. The next will be at 10 o'clock. Because once it strikes their memory and becomes a pattern, then they will know that at 8, I'm taking my medication. At 10, I'm taking my medication. After that, I'm having my breakfast. So it will also become part and parcel of their work, and it makes life easier also for the caregivers. And as such, avoid the conflict that usually occurs with taking medication.
Thank you so much, Immaculate. As we have Dr. Jane on, I would like specifically to ask you that how can caregivers handle patients who refuse to take drugs, and other tips of difficult patients in relationship to the caregivers. When you come on next, please make sure you emphasize that side of the tips caregivers should walk away with. Otherwise, thank you so much. This is the rich experience from Denmark, and we are certainly going to make sure that we take the depth of it. I would like now to invite Dr. Jane to come on and share with us the care, her role as a caregiver to mom who is 90 years old. And as I had earlier said, Jane, you aim at enabling her age with grace and dignity. So now we have about 31 people online, and they are eagerly waiting to hear how you get on with a mom. And please describe to us, mom of 90 years, is she able to move around on her own? Is she able to take her medication on her own? Tell us about her, give us a picture of mom at 90 years and the care tips to a 90-year-old mom. Dr. Jane, good morning, and you're welcome to share with us.
Thank you very much, Doctor. Thank you very much, Dr. Christina. I'm extremely sorry about the hiccup about the auditory aspect of this program. I started at 9:30 and I've been on it, but then somewhere we lost we couldn't hear, we could see, but we couldn't hear what was being said. So I'm happy now, at least I'm just on my phone. I've moved from laptop to my phone. Sorry about that. I'm very sorry about the delay, but I had done it Gaza style 30 minutes earlier. Thank you very much, Dr. Christine Kadama, for allowing me to share my experience of caring for my elderly parent with other caregivers on this forum. I must admit, I'm not an expert. I'm just learning on the job, and I'm sharing my experience of these 4 years. My mother is now 90 years old. Her biggest problem is the chronic degenerative arthritis, which has made her almost immobile. And she moves about with crutches. She's not willing to start using the other modes of what I mean, something that could assist her to move more. She just still wants to see that she's on her feet on her own. She has mild hypertension, high blood pressure, which is stable, but she's mentally alert, has good hearing and good eyesight. But because of the reduced mobility, she had gained a little weight recently, the last 3 months or 4. So weight now also is a problem, and the doctor wants us to help her reduce her weight, though she's eating mainly fruits and vegetables and a little carbohydrates. But that's where we are for a start. But she can still do a few things on her own. She walks around the house supported by one crutch, and she can wash a few things in her bathroom and wash her face, but she has to be bathed, assisted in the bathing, and she can still feed herself and can do mentally. She can do a lot of other things. That's my mother at 90 years old, but it's painful to see her. She was such a strong woman who used to work on the farm, but I think that's what hurts her most, is seeing herself seated most of the time of the day. So that's my mom in short. For her day, we say her day, she was a midwife for over 40 years. So, and I'm a medical doctor, so we both function better working on routines. So she still wakes up at 7 a.m., asks for her cup of tea, gets out of bed by 8, begins her day with prayers. She's a strong Catholic. So that one cannot be missed out. Then we help her get her ready for the day. She's still interested in choosing what she wants to wear for the day and what she eats for the day. So breakfast is usually around 9. We usually porridge fruits, mainly fruits, and a glass of water. And we help her. It's us who give her the medications to make it easy for her. And the supplements like omega-3, vitamin D, and calcium. Then at around 11, she has to go outside in the sun, sunbathe, and walk around the house as an exercise. And then after that, we work, she has to work out her brain. I've taught her the Sudoku, the number puzzle. So there's a whole book of that puzzle. She has to do 1 or 2 every day to keep her brain going. And then by 1, she usually takes lunch, and mainly because we don't want her to gain more weight, it's mainly vegetables and a little carbohydrates. She takes a nap between 3 and 5. Then after that, she takes tea and walks outside and sits outside and watches people pass by. Then by 8, she takes a bath after that. By 8, she takes a hot drink and takes her last medicines. And the day ends with a prayer. We pray together. And that's Mama's Day in short.
Thank you so
Yes.
much, Jane, for that Mama's Day. I was calling her mom because she's a mom to all of us. At 90, she's our mom. That looks like a full day of activity. All of them timed, and you want to emphasize that she really sticks on this time. Breakfast at 9, lunch at 1. I think it's a very, very good routine. Does she take some sleep during the daytime?
Yes, she does. Between 3 and 4, usually she naps. And it is part of the routine. She does. She naps, actually.
Okay.
Yeah. Mm.
Dr. Jane, are there any other activities not done daily that you may have involved your mom in over the years so that she keeps occupied, engaged, really not on a daily? Any other activities you want to share with us?
Yes, on Sundays, she used actually to walk down to the nearest St. Kizito Catholic Church, which is very near here. She used to go there 4 years ago. She would walk there and then back. And that one was done every Sunday. But these days, every Sunday, she sits on that television. There's usually a service either in Ruvaga or somewhere, some other place. And she actually participates in it. And once in a month, we ask one of the fathers at the St. Kizito Church to come over and pray with her and give her Holy Communion. And then other activities involve. Before, we used to take her to her farm. She had a herd of cows somewhere in Bala beyond Kayunga. So she would love to go there and just know what was going on. And she used even to take care of her banana garden right behind her house. And because she has always had green fingers and has always been interested in farming. So those are the things she does. So, but now as she is declining, she gets less mobile. She needs exercise more. So twice a week, a physiotherapist has to come in and help her exercise and massage her. And then on Sundays, usually, it has always been a visiting day for the grandchildren and friends. Usually they come over and she lights up as she talks to all of them. So those are the main ones.
Thank you so much. She used to go to church. Do you, apart from the priest, does she have like a group of fellow Christians who come to your house, to her house?
Actually, pre-COVID, they used to come over. But after COVID, we have to start to move again. One or two usually come and pray with her because they know her very well. She's the most senior person in the village. So she knows most of those people. One or two usually could come in and pray with her, or just to talk, to know how she's getting on. Yeah, that's what it is.
So activities like playing the role of a Kakade at Kwajula and now completely out, not because of COVID, but for her as an exercise or a socialization or outing. You could have planned for her any other outings outside the community, the nearby community. They usually get excited so much. I have known someone who had not been on the Northern Bypass during their youthful days, and when taken to just a ride along the Northern Bypass, was so excited, like trying to target their mental sort of excite their mental capacities.
Yeah, we used to take her out, and there's a grandchild who lives nearby. Sometimes comes for her and takes her to a place. But the biggest problem is she has the fear. What she fears most is that when it comes to using a toilet. So that's what actually keeps her home. So when you are thinking of an outing, you have to think of the toilets first.
Yes.
Yeah, that's the biggest one.
It's a very good reason, actually. When you have arthritis, our toilets can be a threat. Okay. What challenges have you experienced and how have you navigated them while caring for mom?
Big one. The challenges are multiple, and some come up out of nowhere. So each day has its challenges, but some have no even solutions because in the Uganda of today, you know, the healthcare system is hardly functioning for the basic things. We have no insurance, and even getting the simplest medicines could be a so we are working in a very difficult situation, all of us who care for the elderly. And we have no community support. There's hardly any community support. So most times just a family affair and friends. So those are where most of the challenges come from. But as I said, one of them is time management. To creating a balance between parents' care and my own essential activities. I write, I do certain things, some things have to be given, have a deadline. I'm still involved in health, I'm not completely tired. So sometimes I find it difficult to create a balance between my parents' care and my activities. And another challenge is sometimes you get so wrapped up in caring about her and forget about yourself. And this could easily lead to stress. So you even as a caregiver, you need to exercise, you need to eat well, you need to have adequate sleep, and you need to be connected with others. Otherwise, you'll be devoured by that role, and yet you have your own life. So that one is also a problem. And at the same time, the other challenge is you have to, as long as she's mentally alert, she has to be involved in what goes on around her. You have to work together. You have to respect her values, and you have to negotiate. It's like a child, and as I care for her, I have come to understand we brought up our children. While we were nurturing them, we wanted them to create situations that will make them grow, develop, and become self-sufficient, independent. But in this capacity, you are just taking the responsibility of her safety and helping her within her limitations to function normally. So that one also is a challenge. You have to be really patient, and you have to learn to be patient. You have to learn to be compassionate. And you have to learn to know that, to allow her the few things she can do on her own. It builds her confidence. And another challenge, as a medical doctor, sometimes I know what should be done, and yet things being what they are in Uganda, you may not be able to do it. So you have to improvise. And the COVID lockdown itself of 2 years also had its own challenges, mainly isolation. It's isolated her and us from our loved ones, but somehow we went through it. And among the biggest are resources to care for her. You need materials like the proper beds, the crutches, the frames, and you need people to help you do the work, and you need money. As I say, there's no function of the healthcare is almost non-functional, so you pay for almost everything. That physiotherapist who comes home twice a week has to be paid for, and her transport has to be covered. But with finances, my 6 siblings work together and we pool money together to give her mother the peace and comfort she needs as she ages with dignity. And for her, she planned during her active life, she planned for her old age. She has some rentals where we can get income, except that it has been low because of the COVID lockdowns now picking up. And the grandchildren have been very good. They've offered to cover some of the essential needs for her care. One of them has for some years paid and have all the fruits needed during the week delivered on time without fail. And the staff, the people we need, we have a good helper, and we have some of the people who live in around her who come in to just talk to her, to do things so far. There's one who used to work in a hair salon. She washes her hair and makes her look as beautiful as she would have wanted.
Dignified.
So that's how, in short, but that's how we manage to do it the best we can under the circumstances.
Then you really brought up the challenges very well. They almost look like no challenges, but I know they can be very, very big challenges. I just wanted you to add a little more about the lady who looks after mom when you're not there 24/7. What challenges have you had? Particular challenges with the person or the person who usually they are young, they are in their 20s or early 30s, and they are busy looking after someone of 90. Have you had any special challenges in that area?
Yes, she has a life of her own. You could wake up in the morning and be told that she has lost a relative and she has to go for the funeral. But fortunately, among those ladies living in the rentals my mother built is one lady who has been there for a long time. So that one is actually willingly comes in to help whenever the other one is away. And every day she checks on her several times because it's a matter of walking to her house. And when they're together, they talk, they laugh, because they're just talking about the good old days. Eh?
Mm.
Yeah, so that is
Good company.
the helper is maybe 35, but she has a good heart, and she had a problem with her youngest son, who is about 10 during the COVID time. So she asked us to help her look after the son. So we allowed her to bring in the son. So now my mother has another grandchild in the home.
Interesting.
So now she works with one heart. The son is even now he's on holiday. So this 1 month he's with us. So he has become also part of us. So it's a matter of a give and take. So it has worked out well for us.
That caregiver is a real blessing, I think. And I think the way you handle accepting her child gives a plus to her, and eventually she gets a compassionate heart to look after mom. Do you give her, apart from the neighbor, does she have like a whole week away or something like that to her village?
Once in a month, she has to go away at least maybe Saturday and Sunday. When I know I will actually I'll be around. But the problem with her is travel these days is very expensive. So,
yes, I know.
So that one limits some movement somehow. Yeah, that's what it is. But she also needs time to herself. It's a lot of work, back-breaking work.
This caregiver is non-medical. You are medical. Mom is medical. Did you at any one time think of like giving her some tips, like on medical side? Maybe we're in a situation where mom is alert and she may do without a lot of external help. But if you imagine if you had some cardiac complication, if she had cardiac complications, she has to sleep this way, she has to sit this way, and so much. Did you at any one time think that she could do with a bit of training in even the lifting mom, helping her this way in the movement, the way you handle, because someone used to handling matoke cannot know how to handle a relatively immobile person, and at that she has a bit of weight, which is a disadvantage, which could end up with causing backache and all that to the caregiver. Did you train her at all? Give her any training?
Actually, she has no training, but she has learned on the job. Whatever I'm doing, I always call her in and we do it together. And she has learned the simple, these home, checking her blood pressure, because we have these automatic machines. And she has learned that medicines she knows, but we always sit together and we do things together. Even the physiotherapist, when she's around, she has to sit in and see how whatever she's doing. But I can see, as I said, caring for the elderly is not, you don't expect usually things to get better. Usually they tend to decline with age. So that's those such things like a cardiac problem, heart problem could arise. But we are already, and we are thinking about it. A time will come when we really need a trained nurse either to come in the morning or that one is long term as the condition deteriorates. But as for now, the 3 years that real lady who lives in the rentals, and the helper and myself. And once in a while, my sisters come in to take care of her. So far we are managing, but we know time will come when we really need a trained person. But this lady is keen to learn, and she's doing very well.
Yeah, that's why I actually said your challenges have been very well managed, and they end up looking like they are no challenges. Before we continue with Dr. Jane, I just want to throw this to Dr. Noeline. Good morning, Dr. Noeline. Would you like to give tips on how carers can deal with stress from being caregivers at this juncture, please?
Okay, I can do that in about 5 minutes. I was in a loud place.
Okay.
Yeah.
Okay, thank you.
I'll chip in as soon as I'm out of here.
Okay, thank you. Okay, Dr. Jane, let's now move a little towards you as a senior yourself, and you have received some care at one point for major illness. What would you like caregivers to know?
I would like them to know that actually nobody wants to be totally dependent on someone. You would want to do the little you can do for yourself, because it gives you the confidence, and it gives you the enthusiasm to continue to want to live. And it helps you be part of what is going on. If it can be helped, everybody would want to do the little she can do for herself. And at the same time, we have to know that both the patient and the carer have limited their life's limitations. So we have to let go of what we cannot control and manage only what we can. So that one also bears on the first one. I talked about limitations, what you can do for yourself. So you have to accept it. It's very hard, but you have to accept it, that this one I can't do, or this one I can't go only this far, because it's just life limitation. I mean, that's what life is all about. And at the same time, I would like to the carers to know that it's important to keep the body, the brain, and the soul of that patient alive, and help her to encourage. Death is inevitable, it will come at one time, but we don't have to be thinking about it every day. So let that person, help her to find out something to which she can cling and live and be happy for that day. And taking one day at a time will be a very good thing for both the carer and the patient. And communication between the family, the friends, and is very essential. That much everybody knows. If somebody really cares, calls you, rings you, or visits, it's something very good actually. So you still feel you are beloved, you still feel you matter, you still feel you are cared for. So that is something that we should focus on. We encourage friends to visit, encourage like that neighbor in the rentals, that lady in the rentals. She comes and sits with Mama, but you'll be surprised to hear Mama laughing, Mama doing. She's a different person altogether. So those are the sort of things one would think about. And the carers too, as we say too, you could be devoured by that role. So you have also somehow to create time for yourself. Don't sacrifice your life for mine. Yeah, you still have a life to live on, and don't feel guilt about it. So those are a few things I would want people, carers, to know.
Thank you so much.
I can
You
chip
have
in now.
You're welcome, doctor. Let's have it right away.
Yes. So when it comes to caregivers, as the two presenters have pointed out, this is a full-time job. It can be really very taxing. Like that Dr. Jen says, you shouldn't feel guilty if you have to find time for yourself as a caregiver. It is very important for your own mental health. I believe you've heard many stories or even seen video clips of older persons being abused very badly by the people who are meant to be looking after them,
Right.
pinching them, boxing them, when they lack the patience or run out of patience in looking after them. So how does a caregiver ensure that their mental health continues to be well? One, if you're the primary and this is your parent, what Dr. Kayondo has talked about, if you have other siblings, put hands together in getting the finances that would help, look after this person. When the one person is left with all the responsibilities, is really a big challenge. And then two, ensure that even that caregiver, for example, if it is a paid caregiver, that they sometimes have time off because they increasingly become agitated and tired. But when they know there is also time they can have for their own to recuperate, we call it respite care. The caregivers have to have their own care as well. Let them go off, let them have a day off. Be nice to them, you, the other people who come in to check on your older person. Because sometimes the older person may be complaining of things that are not actually true. In the beginning, we talked about forgetting to eat or forgetting to take medicines. It is very common for them to say things like, these guys don't give me food, these guys hide my stuff. I recently had someone tell me just last week, they've had to change 5 house girls in, I don't know, I've forgotten the time frame, but it was all since the year began. Because each one that comes, the mother complains of something and they believe her. So take time also to be around and appreciate what goes on and be gentle on that caregiver who is the full-timer. That's my bit.
Thank you so much, Professor Noelina. I'm sure many seniors here are taking notes. And as Dr. Jen said, prepare yourself for those days. You can imagine when you complain, turn and toss the whole night and the caregiver stays wide awake. And in the morning, you are shouting at her as if when she dozes off, then you back at the caregiver. This is really your issue. You have not worked on yourself. You need to appreciate that the person taking care of you is also a human being. They get tired, they get worked up. Give them a minute yourself, be nice to them as the senior yourself. And if that is supplemented by the rest of the family or the whole cycle of givers, I think that the caregiver will feel comfortable. We've had tips from Dr. Jen, and I think I will need to get on with a closer look at Dr. Jen herself. Again, Dr. Jen, as a senior, what would you advise? This is being really very specific. advise and recommend to other seniors to encourage them age purposefully. And let me also just give this to you so that you come out once. As a senior, what would you like your children to know, or what would you like them to receive from them as your children?
Thank you, Dr. Christine. I would to encourage the seniors to age purposely, that is living healthy lives, living within your limitations, but living, not dying every day, but living, truly living. They've already come up to accept life's limitations, letting go of what you cannot control, and keeping your body, the brain, and the soul in top shape. Exercising, we've talked about them. Feeding and adequate sleep are essential. And the connections and conversations which go into communication with loved ones and friends, they're all essential. And living your life every day, every moment you can, you have to savor it. I mean, enjoy it, because it won't come back. And the more you appreciate and the more you take interest in what is going on around you, in the flowers, in the banana garden, whatever you're whatever you're trying to do, it will help you. So you have to focus on living other than death, because it will eventually come, but you have to live now. You are supposed to be living. You are not supposed to be dying, though the body is becoming weaker. But let your spirit be strong, let your soul be strong. And it can only be strong by how you allow it. You yourself, nobody else can do it for you. So that is about what, and at the same time, these are for the young ones, the young people. They should start preparing for old age while they're still young, in terms of exercise, keeping fit, medical checkups, all those things. They have to start early on. And at the same time, they have to save money to look after them, to be used to look after them in your old age. We don't want to be burdens to our children. They have to do it, but we have to make it easy for them. If there's someone around, then they just top it up, other than for them to sacrifice for you. So, and the other question you asked me about my children, what I would like my children to know. I want them to know that the small little things they do every day consistently, either a text or a call, they add up to something big for that elderly person. And secondly, they have to know the reverse of roles take long to accept. I mean, to be looked after. You've been looking after since you were a child, a female child, a girl. You've been looking after your brothers and sisters in the family.
Yes.
But this time things have reversed, the roles have reversed. And even for the men, things are changing. Men are also being thrown in the roles of care. Either they have to care for their wives or their sisters. It's no longer predominantly for women, as society had assigned it to us. And I have to remind my children that caregiving has its rewards. Some are visible, others are not visible. But the most important one, it is the self-respect that comes from doing what is needed. Whether somebody notices or not, or thanks you, just that self-respect. And it builds your character. And you become more sensitive to other people's needs, and you become more flexible, like allowing that helper to go off. Those are things that come through what you have experienced. And my children should know that I love them dearly and pray for them every day, that they continue to be fair, kind, giving, and disciplined and responsible people. There is a last quote I would want us to consider. It's by someone called Tia Walker. It says, to care for those who once cared for us is one of the highest honor. Thank you very much.
Thank you so much, Dr. Jane. You are really given a very stimulating experience. I would like to have a few questions directly to Dr. Jane. Then we'll ask Immaculate to come on. You can put up your hand, put in, or a comment if you want to add on something, an experience you've gone through, which you think the rest of us can benefit from. And maybe before I take someone on, I would just want to ask Dr. Noelina and Dr. Jane what they would feel, or what advice you give to this situation where the children, let's say children who are 40, 50, are like appearing to be overprotective of the senior. They will not let you move here. You go, like you've lost someone up country who was dear to you during your time. Then they will put a bar, don't go, you are not going to be here, you're not going to go here, you're not going to go there. You are literally a prisoner in your house because they are trying to protect you, but it ends up like feeling like they are being overprotective. I don't know if you get the situation, but kindly comment.
Thank you, Dr. Clem. Yeah, I can relate to that. They are being overprotective, but each one has to remember, each one of us, even the children, each one has a life to live, And there are small things for each individual which make them happy, which make each individual happy. And what you want to do is it can't happen all the time, but at least to be comfortable and peaceful. If you want to move, to travel and see a friend, and it's not, as I told you, my mother is more worried about the toilets. But at least if you can negotiate with the two of you, can negotiate. Let her live her life. We try to convince her, yes, once in a while, the toilets, you will need the toilets, but once in a while, you have to get out of that same environment and change. So it's not good to be overprotective. That person has a life to live. And as long as she's not going to be hurt, as long as she's not going to cause you, as long as it's not something that is going to harm her, let her be. The parent also has to understand that they are doing it out of concern for her. So there has to be a negotiation. It's not just a free.
Thank you, Dr. Jane.
Right.
Professor, would you want to come in?
Yes, I want to add on a few points. So Dr. Jane earlier on in her discussion talked about the reversal of roles. When we were young, our parents would take us out. And it was always something that was very exciting. It's the same thing. If this person still feels good about them going out, why not? But also, because there's a lot of isolation for these older adults, they hardly ever go anywhere. I would encourage people to make it intentional in taking out this older person maybe once a month. Take them somewhere once a month, so that they are always not indoors or just looking at the primary caregiver they may be with, and really having very limited social interaction, because the more you're socially isolated, the higher the chances, if you haven't yet developed dementia, for you to actually eventually develop it. But even for those that may already have had it, they enjoy it. It's good for them to mix with others, their age or not their age, with grandchildren, you know, from time to time. In our previous talks, I also talked about the point of looking after these old adults in their own homes. From the question that Dr. Kadama you posed, it would sound like this person left her home and is maybe somewhere else, and she wants to now go bury maybe in the village where she grew up, and this, you know, people are allowing her to go. I always encourage people, and I think I still gave you an example in one of our previous talks of a lady who they brought to me earlier this year. She was in tears, terrible tears. She wants to go home. The children have refused. Stay in Kampala, you're nearer the doctor, you know, etc, etc. She's a very strong, I think she's almost 100, but still very sharp upstairs. And I told them, this lady just needs to go back home. Can you sort yourselves out and you take her back home? Eventually they did sort themselves, and she's home and she's happy. So yes, we want to be protective. We think if they go out, they are going to catch infection. I think we also have to appreciate where our power ends, and as a being, you know, God or whoever takes over in looking after this person, just always provide. As Dr. Jenna said, for as long as you know she's not going to be harmed, you know, indulge her in that, going for that barrier. However, you also have to set limitations. It shouldn't be excess, like, you know, every weekend she wants to go and bury someone or visit someone. That also is a little too much, because financially, it may be a little more burdensome. I also just want to warn that one of the symptoms of dementia is for people to always want to go somewhere. So they may, don't confuse. Sometimes they keep on saying, I have to go this way, I have to go this way. And if you're not careful, you may end up traveling the whole of Kampala, you know, back and forth, or rather Uganda, not even Kampala, back and forth, because she says, I want to go there. When you reach the other side, she says, I want to go back the other side. So sometimes that may just be a symptom of dementia onset, and to have it well for adequate management. Over.
Thank you so much, Professor. Ronnie, you've got your hand up. Could you unmute and ask or comment?
Good morning, everybody. I would like to add something. I agree with what the doctors have said also. To the younger ones, I would like to suggest that they maintain hobbies or things like that, so that as they are slowed down by age and mobility, they are not that isolated. I agree about sharing times of caring. This is a person who is used to taking care of themselves, but then now you relegate her to just hired caregivers who are younger or something. One thing they resent, exposing themselves to be cared for by those, they would take it better if they did. So same way as you don't want to, you want to change environment, you are used to going everywhere you want. You would like to go for changes. Also, I've found something, because being in the diaspora, when something happens, my daughter is the first one, where are you? Or something. They are concerned, genuinely concerned, but they need also to know that these people need exposure there. You remember the herd immunity that also comes in, sometimes plays a place, but above all, help her to exercise. She's used to entertaining all relatives and something, then you expect her to start staying inside four walls all the time. Let them mix and relay, but ensure that their diet is adequate. Supplement as much as possible. Over there, at least you still have you have a lot of natural foods. Help them juice or something, but above all, keep them surrounded by familiar people, the people they love, as much as possible. If you're blessed to be a number of many siblings and cousins or something, take turns. You say today it's so and so this weekend, so that she also starts looking forward to the weekend that people, because when they get to that of being staying indoors with one person, they feel abandoned or something. Loneliness sets in, and also remember the hormones are no longer balanced. Anything is bound to happen anytime. That is my take at the moment.
Thank you so much, Ronnie. These are very useful tips. I want to sort of change and ask us to get tips from Immaculate, Professor, the audience, and Dr. Jane. So I'm going to put like three challenges on. One is specifically to Dr. Jane. Do you live with your mom, or the mom lives alone? You answer that and probably add on whatever else you feel is correct. Then we want to have tips to encourage seniors to be socially engaged. We are looking at, like, if the seniors are not interested in being among other people, what tips can we share with the caregivers and maybe the family? And these tips can come from the audience, from Professor, from Immaculate, and from everybody. I think, Immaculate, please feel free to give the tips relevant to these questions as we go along. I think we seem to be wrapping up at the same time as doing Q&A. Dr. Jane, the first one is very easy. Can you answer it? Or have we lost Dr. Jane? No, you're still there.
So as you look for Dr. Jane, Immaculate talked about being in a home. For me, I'll talk about and she'll give tips of keeping an individual socially engaged in a home, because there are usually a variety of activities there. But now in the community, the things that we normally encourage for people is, until when they cannot be able to keep within the social activities. Like Dr. Jane's mom used to go to church until when she couldn't, anymore. So encouraging people to interact within the community for the common activities that we have around. I once visited a place where they would get older adults once a week to come to a nearby health center within their community to have their blood checked and, simple monitoring of how they're doing, but blood checked for sugar, they check for hypertension, but most importantly, have a dance class. Because whether demented or not demented, music is usually a good thing for people. So they would involve them in a dance class, which also kind of contributed to the physio therapy session for those individuals. And the dance is not rigorous. It is dance that can be performed by an older adult. And I'm hoping that this association, as we grow older, those are things that we could eventually put in place. All you have to do is have a person go and lead the class on how to keep these individuals socially engaged in activities. But as we also said, talking to neighbors, inviting someone over for a cup of tea, or moving over to the neighbors for a cup of tea is good social engagement. Immaculate, you can add on more for what happens within the home. When we say home, by the way, first say what a home is, because we've made an assumption that everyone knows what a home is.
Actually, I don't know how, in Danish, we have what we call a home, your own physical home. And then we have, it would be like a care home. That's the assumption we have now concluded here, calling it home. Because we have our own family homes where we belong. Then we have the care homes. Home
yes,
care
I'm talking about care
centers.
home.
Yeah, home care centers. But now the activities, we would engage, keep them actively engaged in activities like you talked about music. And then the other thing is like, one is to know their life history. What was the person most interested in? Like Dr. Jane said, her mother was a midwife and was interested in farming. So that life history is very important in planning the activities for the particular person, because when we plan activities to engage these people in, they should be centered on what the person was doing before. If the person was maybe an artist, use art to stimulate that person's activity. So in that case, we take them out to maybe where they're artists, music, as you talked, music, songs, and dance, especially music of the person's generation, is very, very effective in stimulating the person's mind and activities, because someone who is easily dance to the music he or she knows or is accustomed to. And then another thing is taking them to smaller children. We usually take the elderly people to nursery schools, or maybe bring the children to the homes to visit. Take them out for a cup of coffee. Maybe take them out into, of course, that is now the European setting, but you take them out into nature so they can see animals, flowers, different kind of things to stimulate their mind, because it also evokes their mind memory, and they begin thinking back, oh, I was a child, I used to do this, I used to do that and that and that. So those are some of the things that can stimulate them. Another thing, showing interest in them, because when they see people, they tend to get attached to them. Just like a caregiver, not every caregiver gets attached to these elderly people. But when you have the empathy, you show concern for them, you show care, it's easier to plan activities with them and ask them out. So it's also good to have visitors visiting around that can have the same wavelength with these elderly people. Maybe as they talk, they can end up on a common ground, say, okay, if you're interested in that, how about coming with me? Can we go with you? And another thing, if you want to motivate these people into activities, don't ask a lot of questions, because once you bombard them with a lot of questions, you confuse them and cause a lot of conflicts. So it's easier to do just very simple things. If you want to take them out, sometimes you don't need to tell them, I'm taking you here. You just hold the person's hand and say, come with me. Can we take a walk? we are going in the car, then they eventually find themselves there. So those are the ways sometimes we help these people in motivating them to come along and take on to some activities. Others would prefer to be alone and say, I don't want, because when they get into this situation, say, I don't want anyone, don't come near me, don't do this. Much as they may not participate in the activity, you can let them sit just nearby and watch, because we've observed many eventually coming in and also begin participating, yet ideally they had said, no, I'm not coming. I don't want to participate into that, and don't tell me anything about that. So that's some of the ways we can motivate these old guys.
Thank you so much, Immaculate and Professor.
Okay.
I just want to add on a little that many of our people, especially in the rural areas, have grown up digging, going to their banana gardens and all that. I've read about a club in Japan of those above 100 years. They decided to make like a center for packing vegetables, which ended up giving them exercise for their fingers and hands, and the company, the conversation, and a bit of income. I've actually suggested this to our group. Vegetables are very easy to grow even on the backyard or wherever. If you pack dodo for all these great ladies in Kampala as a club of elders, it could fetch a bit of money for the elders, and also give this company exercise outing for the seniors. I think Mama Jane actually lives in her own home, and Jane does not live exactly in the same house with Mom, but you can call it same compound. She lives in her own house next to Mom, but services like food and whatever, Jane can always cross to Mom's place. I want to ask Dr. Philippa to give a wrap up and thank to the presenters today, and also pass a few announcements for our audience, and then we wrap up.
Right, thank you very much for moderating this session, and special thanks to everyone who has been engaged, from Dr. Jen to Immaculate, Professor Nakasuja. Thank you very much for sharing with us today. I have personally learned a lot, and I think we have great tips that we've got for carers, from encouraging them not to feel guilty and to learn to take time off to recoup and be mentally healthy so that they're able to do a better job, but also tips on the people who are being taken care of, to learn to enjoy the things around them and focus more on living and not dying. I think that it's been a really enriching session, and I plan to listen to this session like 2 more times to just write down each and every one of these tips, because I think many people will benefit from them. Yeah, so thank you very much, everyone. And I'd like to just mention that our next session is going to be about finances, managing finances for seniors. And I think it's a very good follow-on. We had some discussion briefly from Dr. Jane mentioning when you're preparing for this time, in the later years of your life, it's important to have some finances prepared. So we want to know how to manage that. If you're already there, how can you manage it better? Or manage the few resources that you have, how can you manage them better? So it will be a good follow-on session, which we'll have at the end of September. That should be the 30th September. Yes. So thank you very much. Back to you, moderator.
Thank you so much, Dr. Philippa. I would like to particularly touch Dr. Jane's feelings. Dr. Jane has been a friend and a classmate from junior school. And I know personally, August is a particularly special month for you. It was not by chance that you happened to be our guest speaker. And on that note, I would like to say happy birthday to Jane. I would like to ask everybody to unmute and say happy birthday, dear Jane. Thank you so much, Jane.
Happy birthday.
Happy birthday.
Happy birthday, Dr. Jane.
Age with grace.
Happy birthday.
Happy birthday, dear Dr. Jane.
Happy birthday to
You.
Thank you so much, everyone. Particularly
Thank you
impressed to
too.
see Mrs. Mwesiga, a jumbo from me. Thank you so much, everybody who has been with us today, and see you next month. Bye-bye.
Thank you too. Bye-bye.